We'd like to welcome everyone to our fifth session of Impact of Dental Health on Preventing Future Medical Complications. This series is sponsored by Aquarel and Philips. And tonight, like I said, we are at our fifth session, fifth out of six. Tonight's session is sponsored by Velscope and Waterpik. And we have with us Mary Kelly. She is an educator, she's a consultant, and she's a healthcare advocate. And we love advocates, Mary. And she works with healthcare providers and community organizations to improve health outcomes. So we're excited about what we're going to learn tonight, Natalie.
Oh, Mary, thanks so much for joining us to discuss this. And so this is really near and dear to our heart. Now, everybody knows my husband is a head and neck cancer survivor, and he has has dry mouth. He's not been formally diagnosed with xerostomia, which is interesting. I'm going to talk to my doctors about that when we go up for our June visits. But today, we're also talking about the dental challenges of the elderly and patients with progressive neurological diseases. And that's unfortunately, sadly, our mom has Parkinson's, and that falls under that category. So before we get started, I want to make sure that we're all on the same page with a couple of housekeeping items. We're going to make sure everybody's been practicing using the chat. Make sure this is where you're going to put your questions in. If for some reason we don't get to all your questions, we will make sure that we send them over to Mary and send them back out when we do the survey tomorrow, and make sure that you guys get those answers. Don't forget, we've also got our continuing education. So guys, when you go onto the chat, if you scroll all the way to the top, JJ has really graciously, it says my name, but it's JJ, who put—
I just put it in there again, too.
Oh my gosh, Jay, look at you.
I know.
We have the continuing education credit link that you can get. And again, this is for our dental professionals, speech and language therapists, as well as our RNs and our social workers. You have up to 30 days to go, and for those who might miss and you're watching this on video, to go in, watch the video, take the surveys as appropriate by your credentialing entity for your CEs, and turn those in. So, and then of course we'll have our survey tomorrow. We'll have all the recordings. So we're just stacking those recordings on top of each other. So as well as our survey, and we are so appreciative of you guys completing those surveys. It's great feedback for us and for our presenters. Now, without further ado, Miss Mary, I think we jump right in.
All right.
Wonderful. So before we start, I want to make sure that what are the diagnoses that are kind of falling under neurological diseases? I even have them pulled up on the side because there's more than I thought. Do you want to list off a couple, and I can throw in any behind you?
Sure. I'll list off the ones that I have the most familiarity with
Sure.
and have done research with. So it's any of the spectrum of dementia, like Alzheimer's disease, frontal lobe dementia, Parkinson's disease, strokes, MS. And then I guess now there's even epilepsy is considered the cognitive. And I guess there's a few more that we were talking about.
Yeah, I'm going to throw them out here for everybody. So Alzheimer's disease, because dementia falls in various categories, as you mentioned, and multiple sclerosis, epilepsy, Lou Gehrig's disease, lockjaw. Little surprised by that one. Huntington's disease, chronic traumatic encephalopathy, and spinal cord injuries. So those are some of your common neurological diseases. And so now that we've kind of established that, I'd like to jump into my first question.
All right.
What are some common challenges as people age, in particular for those who have progressive neurological diseases?
All right. Well, I'm going to first take a step back and give you a little bit of introduction of myself, a little more, so that way you understand where the perspective that I'm answering some of these questions from. So okay. I am a dental hygienist, and I have always worked in small private practices, and so they're more family. So I have worked with a lot of older adults, and that just seems like the majority of my practices, 60% of the patients or more were over the age of 50. And then I finished my degree about 8 years ago after being in practice for quite a while. And I have a master's in dental public health. And so I did research on the older population. Almost all the research I was hired to do was in nursing facilities. And then the last research I did after I finished my master's degree was I would go into people's homes who had a dementia diagnosis.
Mhm.
And I would meet that person where they were at as far as their spectrum or their level of dementia. And then I would teach them and their caregiver how to take care of their oral hygiene and to prepare them for where they were at now for the whole spectrum.
Wow.
So
Okay, so you are highly qualified, my friend.
I just have lots of experience
That's exactly right.
in this. So yes, common oral challenges for every older adult is tooth decay, periodontal disease, and after the age of 60, oral cancer. But I want to concentrate a lot on tooth decay because tooth decay is different in older adults, especially people with cognitive degeneration. And it's called root caries. It's just caries is a fancy name for tooth decay. But the root caries is along the gum line. And as we get older, our gum line recedes, whether it's to periodontal or gum disease or just natural some recession. And so that area of our tooth, even though it's a really hard surface, the roots, it doesn't have the hardest enamel. And so it's more likely to decay. So you might see plaque or brown or even black spots along the gum line, and they kind of look leathery. And so that's root caries. And it's really difficult to control and really difficult to treat on people, especially if they have cognitive decline. That it's just that it's harder to treat in the dental office, and it's usually not just one tooth. It happens to several teeth because of their softer diets and things like that. So some things that are unique to the people with neurodegeneration would be their functional ability. So they have the reduced capacity for self-care. They might have pocketing or food areas that are not as self-cleansing as they lose the musculature. And this would be for any of the cognitive or neurodegeneration, is that the mouth actually kind of self-cleanses itself. The tongue knows where to go, the cheeks know where to go to get all the food swallowed. But as the muscular and dexterity lessens, so does the reliance on the tongue control and the self-cleansing ability. It's harder to close their lips. And so it just makes them much more high reliance on others for oral care. And then also just the impaired thinking. That is another thing that's unique to the neurodegeneration. It's how to carry out the task. They might know that they need to brush their teeth, but they don't know how to do it. Or they might just brush in one area. They might not do the entire mouth.
And would you attribute that to kind of memory issues, loss of memory issues, and just of that? Would you attribute it to that, you think?
It is some memory issues, but it's also the executive function where they know what to do, but they're not able to carry it out. They don't know the steps. Similar to how they're lessening their walk, they slow down walking, or they have the visuospatial trouble, is that they just don't have that. The brain isn't telling them their bodies how to do everything. So they might even know what they're supposed to do, but they are unable to carry out the task.
It's honestly, Jay, that's like, there's a lot of steps if you think about it in brushing your teeth. It's like, we work with people, if you think about knowing steps, I think it's like 35 steps to make a peanut butter and jelly sandwich. So I'm pretty sure take the cap off. There's also handle kind of holding the items and things like that. So when you really think about it, there's a lot of steps to brushing your teeth.
We figured out 17 steps.
There you go. 17 steps.
17 steps. So, and we just did this with a group of dental hygienists last weekend at our state meeting, as far as how many steps there were and like the peanut butter and jelly sandwich equivalent we did to brushing your teeth. And that doesn't them out on it.
That doesn't count all the movement you're supposed to do. So that's just
for how long.
Yeah, and how long. Okay. Now this is the hard question. As a caregiver, this is a challenge for me. So are there particular challenges for caregivers in providing care that you want to toss out there to us? Because I know we're going to get to that point where you're going to say, okay, JJ, now this is my advice. So, because that's what we need to know.
Well, there's a couple different angles that we can go at this, but one is the lack of confidence for the caregiver, that they just don't know how to do it. So, possibly even a caregiver doesn't have importance for themselves on oral hygiene. And so then how is it to do it for somebody else? I mean, I'm going to talk about, don't let me forget to talk about that one too. But stinky breath, gum disease and cavities really have a bad malodor. And there was surveys that showed that CNAs would rather do the perinatal care, clean their bottoms than brush their teeth.
Really?
Because,
Wow.
yep. Well, think about brushing teeth is kind of intimate in the opposite ways because you're actually looking at them and like at their eyes, and you're actually putting their toothbrush or your fingers in their mouth. So so yes, it's pretty difficult to have the confidence. And then the fear of being bit. That's big. So the fear of being bit. And so that's where I recommend different oral hygiene things. And that's I recommend the water pick because that's something that somebody else can do for you. And I never recommend someone else flossing someone's teeth because of just the potential. And I have been bit by young and old, and older adults. So that's where doing different devices is really important.
Yeah, and you mentioned don't let you forget about the individual caregiver's own hygiene.
Okay. So there was one person, she said she would run away. It was one of the families I would go in and visit, and she really, her husband didn't value oral hygiene. He had early dementia, and he just had a lot of apathy, but he really liked like gadgets, etc. And knowledge because he was an engineer and now he worked at a library. So he really wanted to learn more stuff. The wife said she would run away every time her children had a loose tooth, that her husband had to take care of that. And so we just built confidence with her, is that he had partial dentures. And she's like, I'm not going to stick my fingers in his mouth and take out the partial dentures. Well, while he was still cognitive enough, he actually worked with them over the week to take in and out the dentures. He showed her how to do it, and it was really cool for him to be in that role. So he had a lot of confidence that she gave him. And then when I came back 2 weeks later to support them again in oral hygiene, she was so proud that she figured out how to do it, and she built the confidence. And so she knew that it was important for her husband. So she's like, I stepped up to it, and she was proud to show me that she could get his dentures in and out.
There's so much of it that's fear, and that's interesting. It's not just oral care. There's a lot of caregiving that's fearful. You're afraid you don't know how to do it. We talk about that,
right?
And you're going to do it wrong. And so that's a good point. It's a good point, Mary.
Well, and we have caregivers of all ages too, Mary. And you mentioned dentures. And I remember our grandmother had dentures, and I'm going to tell you, because we're from Tennessee, and not that Tennesseans just leave their dentures laying around, but my grandmother did. And I always thought it was really weird. And I remember her brushing her teeth, that it's also important to brush those dentures because I'm assuming there can be negative impact if you're not keeping up with the hygiene of the actual dentures or partial dentures.
Right, absolutely. Dentures get plaque, and they get that hardened plaque called tartar or calculus. And it's full of bacteria. Plaque is just 700 different bacteria in your mouth. And so if you do need to, and you can just use a soft toothbrush or a denture brush, it has to be a separate brush than your denture. Okay. And it's really important to brush that as well. But also it's important to take that denture out for several hours. If you leave the denture in while you're sleeping, it's like wearing gloves on your hands all night. And your hands are going to get kind of irritated if you don't get your hands the time to breathe, just like you need your dentures out while you're sleeping to give your gums time to breathe. So, yeah, denture care. And then you don't want to put all of it back in. You can get some candidiasis and some other yeast infections and other infections if you keep putting dirty dentures in your mouth.
That's something that's in our future, because our mom's having to get some partials just because she's had dental issues with her teeth. And so we're gonna have to study up on that, Jay.
Yep. And there is a special way to put them in and take them out. And a lot of people know how they do it. They're used to putting their denture in and out. And so they might just have their special way. I even have difficulty putting other people's dentures in and out because of the special click that their tongue does. And that leads me to another thing that is really important, is find out the person's preferences before or while they can express themselves. Like do they like to eat? Do they like to brush before or after breakfast? What flavor
Yeah.
toothpaste do they like? You know, a lot of times when it's your family, you know, but if it's your mom that has lived on her own for a while, now she's moving in with you, did
Yeah.
you bother to see what type of toothpaste she likes?
Mm.
And then as the taste change, or as if there's dry mouth, then she might want to have a more mild toothpaste to use.
Mm.
So
Yeah.
find out the preferences. Let's see. I'm just oh, and of course, in between the teeth cleaners. So does she use dental floss? Well, I think dental floss isn't the way to go. That's where you might want to switch to something that's easier, like a water pick, or little brushes that can brush in between the teeth.
Mm. That's a good
As
idea.
far as the water pick itself, I know we had talked a little bit about this, but I'm somewhat ignorant. So I knew you had one.
Yep.
And
Okay.
because
Here.
one of our issues was that ours was attached, but we have
Right.
problems with mom's teeth and she has to have someone else brush them at her nursing facility. But you
Okay.
say that one's not connected, so someone else can
Right.
use it.
Right. This one is called the cordless advanced.
Mhm.
And okay. And so it doesn't it's a rechargeable battery, and so in 4 hours it charges for 28 days. It can be taken in the shower, or just how I usually do it is I have someone, if they're in a facility, it's an emesis basin. If they're at home, it's either the big red Dixie cups or a bowl. Put a towel on them, and then I can water floss their teeth for them.
Mm.
And they just lean down into it, and then it just drains down. Very effective.
Wow.
Not as messy as you think. As long as they're looking down and their cheeks are loose, the water is all directed right into the bowl.
Oh, that's really interesting. Yeah, my husband's good at using the water pick. I'm not gonna lie to you. I'm pretty sure I would have to do my hair again a second time. So I'm pretty sure I'm gonna get it all over my head and everything, guys.
No,
Okay.
no. I use it before I put my makeup on, or after I put my makeup on, and my makeup's fine. So,
Oh my gosh,
It's
girl,
a
you're
skill
pro.
set. We got you, Mary.
yep.
That's funny. So what are some of the signs or symptoms that a person may be experiencing pain? Because I think this is going to be really hard for people who have neurological disorders because they can't really verbalize that pain potentially.
Right. Not only can they not verbalize it, but sometimes they don't even recognize it.
Mm.
So they don't know that they're in pain, because of just all the sensations are being felt differently. So
Yeah.
you really need to know if they've had dietary changes, that their food preferences aren't the same. They're taking longer to swallow or to eat, weight loss. And then maybe even as simple as, like they're touching their cheeks, or they have a fever, or they're being really extra agitated. We had a family that he just had dentures, and he kept getting agitated. He says his dentures were fine. He had no trouble with them. His wife came into the dental practice, and the husband was sitting in the waiting room, and I was like, let me just look at him. And sure enough, he had a huge sore around his dentures that he didn't even know about, but he had been changing and had his weight loss. So, and if you lose more than 10 pounds, your dentures or your partials usually do not fit.
Okay,
Wow.
so I didn't know that.
I didn't either.
It's interesting. If I
Full of
lose
all kinds of
weight,
trivia here.
That's really great.
I
It's
mean, I
good to
thought,
know
you can
because
lose weight and that can happen with your shoes, but I did
Yeah.
not realize your teeth. So let me ask you this. This is a sidebar question. Can dentures also give you xerostomia or start to give you the feel of dry mouth?
Yes, definitely. So, because you need you need a lot of saliva for your dentures to fit into and to be comfortable to touch your cheeks and things. And so, so any dry mouth is going to be exacerbated with dentures or partials. So definitely. So
Yeah, and I've got a question here off to the right. Folks, feel free to put your questions in under everyone because this one came to the host and panelists. No big deal because we're going to catch them all. Jana asked about, do you recommend a 1.1% sodium fluoride toothpaste or gel?
yeah, that would be up to your dentist to recommend that, because I think at that it's a prescription strength, but awesome. Yes, definitely with root caries and with dry mouth, you definitely want to up your fluoride intake. So,
Okay.
and you only need a little bit. And right before you go to bed is the best, because that's the time you have the driest mouth, whether you're highly functioning or xerostomia.
Well, can you use the sodium fluoride with a product like a coral?
Yes.
And that doesn't impact the fluoride impact?
Right. A coral really makes everything a lot easier. It's going to smooth out, give you a lot of lubrication. And so it will actually enhance anything that's in your mouth already. So, and a coral, I think they even say that you can use it incompatible with other products like xylitol products. So, yep, here's my coral.
Oh, here, hold it right in front of your face. There you go.
There you go.
That's what happens. Our backgrounds lose everybody except for my Beagle picture comes back. Yeah, I would think that with fluoride, you would want like the lipid based over the water based, because a water base is going to impact that fluoride, at least because I know that Jason has to have nothing in his mouth for at least 30 minutes. You don't want to impact that fluoride.
Exactly. Yeah, you shouldn't be rinsing your mouth after you brush your teeth, because that water is going to rinse out the fluoride and you want the fluoride to be in there. So yeah, and the coral is a perfect complement to it because it's not going to rinse that out. And that's the good thing about a coral being a spray, that other people, a caregiver can give a coral, administer it. You don't need a sink for it. And it just stays in your mouth a lot longer. I used it right before I started tonight because I do have dry mouth from my CPAP machine, and I've noticed now it's not only overnight but it's during the day. That's how I started with the coral as a personal user of it. So
and we will tell you, Joanne Jones did as well. One of our other speakers, she said before she speaks, because she does have some dry mouth, she uses it as well. I was like, this is really interesting.
There you go. And I speak a lot, and I didn't even think about that. So good use.
We did. Oh, there is Joanne. She was
Joanne,
like, I do.
Joanne.
We did have another question because you did mention fluoride. Janet, did you get that one, Natalie?
Yeah, sure did.
Oh, sorry, I missed that one.
That's
sorry.
Okay.
Yeah.
So do you want to go to the next question?
I was looking over at the site, Natalie. I'm so
excited.
I know. I'm so excited. So, are there things to look for or to identify if a person is experiencing xerostomia or dry mouth? For example, my mom, because she can't really, again, she doesn't really know what's going on. What would I be looking for dry mouth in particular?
Yeah, that is really important. People with Alzheimer's disease and related neurodegenerative disease don't even realize that they're thirsty. And so, so there could be dry mouth due to like that you don't have enough saliva, or just dry mouth as a sensation because you're actually dehydrated. And so you do need to look for, like, if they're having swallowing issues, if they're having trouble talking. That's why we use it before we speak, is because we need some lubrication in our mouth, to speak. And then you also want to look at what medicines that they're taking, since they can't express that they're having dry mouth, are they taking antihistamines, the PM drugs, anti-anxiety drugs, antidepressants, diuretics, high blood pressure medicines. I mean, there's so many medicines that has xerostomia and dry mouth as their side effect. And so really being an investigator as a caregiver for people who can't express them themselves is really important.
And here's the thing, I would even include cannabis, because in certain states like Virginia, medical marijuana is an approved use, approved for individuals for pain, for, I know that it helps with neurological disorders like Parkinson's, to help with the tremors and things like that. But of course, so you've got tremors, that's a side effect. Our mom has the tremors. And and so if she were to use that, I'm not saying that she would, because she would literally die. Sorry, she would, and I'm a big supporter. But it would create another side effect, which is dry mouth. And so I think those are important things to think about, that if you are working with someone. Would you agree?
I definitely agree. And I can again speak from personal experience. I have used legal cannabis drops. And when I use it, I definitely have the xerostomia. It's just incredible. And I like research, so I eliminated anything else, all the variables, and it really is just the cannabis itself. But you got to do the cost and benefits. And so if you can outweigh, I think you're taking medicine to get rid of side effects of other medicines. I think we were talking about that. Right. And so again. And I can't say enough about a coral because it's lipid based, and so it's going to stay in your mouth a lot longer. So it really helps when you're sleeping or just less frequency. So it's much more convenient than a lot of the water based sprays or mouthwashes, or not water based sprays, water based gels and mouthwashes.
Right. So I have a question, because mom has lots of doctors and I keep focusing back on her. But when I realize this is a problem, when she's having trouble talking, or I realize that, she's having trouble swallowing, who should I talk to? Because there's so many doctors I talk to.
Definitely.
Who's going to give me an answer?
Right.
Who's going
All
to
of them.
recognize it?
All of them. So I teach a
Okay.
dementia prevention course, and we have all the participants come in with their list of medicines and meet with a pharmacist. And then the
Okay.
pharmacist then talks to their healthcare provider and then their dental provider. And then especially with people with swallowing issues like Parkinson's and any of them, their speech pathologist, because they can give them other things. So it's really is a group effort. It really should be interdisciplinary with any of the kinds of symptoms. So I say all the healthcare providers that you can think of would probably be involved in if there's health issues or side effects from medication.
Well, and I just keep thinking about, I mean, whether it's Jason, it's our mom, or whoever your loved one is, when you said you're a CPAP user and that it creates dry mouth for you, I just think that as a caregiver, I think back to 2 years ago when we were in Jason's active treatment, and they talked about that ropiness in the mouth because of the radiation and the chemotherapy. And, they said, these are some things you can use, but it's just kind of like, I wondered, we didn't talk about it with his speech and language person because of course he had to practice the swallowing, a lot of different doctors.
Mm-hmm.
So I think when I go to the doctors this time for checkups, asking them more specifically about when they recommend medications, is there a side effect that is going to negatively impact that could feel low level, but it's really not, because think about all of the side effects that people are experiencing overall. Any other recommendations or things that we would want to ask for to the professional?
Well, absolutely. And why I think it's important is because some of the doctors have given you the answer that that's what they learned in medical school or that's all that they know.
Mm-hmm.
And it kind of breaks my heart as far as there's so much research. And so that's where I think, going to a pharmacist and getting a second opinion and having them collaborate kind of brings any of the healthcare providers to task when they have to do that. So and different opinions are really helpful at problem solving.
I like it. I think the more you ask, the more you get to know. I think you're better informed. So one more question. What is the most important thing that a caregiver needs to know about assisting or providing oral care for a loved one?
Okay, I'm going to give a couple most important things. Like a couple tips. All right, for that fluoride toothpaste, if someone is in an assisted living facility or a nursing facility, have a physician prescribe that toothpaste to be brushed on before they go to bed. Before they go to bed but have it as a prescription, because as we talked about, it's part of grooming is where oral care falls into for nursing facilities. But once it's a prescription, then it falls into it falls into a have to type of thing. So that's my biggest hint. And then brushing doesn't have to be in the morning. I always say brush it in the morning for your friends because that's where you don't have that stinky breath. But in the nighttime when your mouth is really dry, that's where you want to perform the best oral hygiene and get rid of all the bacteria that's been in your mouth and all that food feeding that bacteria. So most disease happens while you're sleeping overnight. But the biggest thing is there's just no exact time to provide oral care. Find the time that works with the person the best. And when you also have more time to do it, because if you're giving oral care to somebody else, or even if you're just prompting, of course, we want to promote autonomy. So a caregiver might not have to actually do the task, but just it's not worth getting frustrated and aggravated over. Plus, if they are progressive enough in dementia, then 5 minutes later, if they say no, not this time, and then just go 5 minutes later and the request might be totally compliant. So yes, don't get stressed out over it and just do it another time.
That's really good advice. Okay, so I do have one more question. Everybody can put a question in there.
I know we're really close. So we're close to being even. We're going to go over a little bit. If you've got questions, JJ, hold for a second. If you got questions, throw your questions in the chat. JJ, go.
So you said in the morning or in the evening. So should I consider myself victorious, Mary, if I get my mom's teeth brushed once a day?
Yes.
I can call that a victory. Because
I would say call that a victory if there's at all agitation or combat. Yes.
Twice is my goal, morning and evening.
Twice
correct?
is the goal, and once is great.
I'll take it any day. Okay.
Oh, I totally agree with that. All right, guys. I'm looking over. I don't see any additional questions, but I feel like Mary, I think reason there's no question is because it was exceptionally thorough. And so I very much appreciate it. We've been all over the place. And I would like to leave us. I mean, you made a comment, and I don't want it's where you said people don't die from a bad hair day, because I was joking about JJ's bangs, but they can get sick from
periodontal disease and tooth decay. Yep. Brain abscesses. Yes.
So I think
diabetes, there's some heart disease, all things. The bacteria in your mouth does not stay in your mouth. It goes through your body. So
oh, okay. So we're going to leave you with that. So that is the importance of making sure we are brushing the teeth. And there's lots of great resources that are out there. Mary, thank you so much for being with us today. I can't believe our time is already up. This has been the most fun today. So thank you for sharing your wisdom with us. Wait, hold on. Ruth has a question. Will laser therapy will be a would laser therapy be a good option?
I don't know exactly what kind of laser therapy for what, so I don't feel qualified to answer that at this
That's
time.
okay. Ruth, if you want to put that follow up, and then, oh my gosh, all the questions are coming in.
Yep. Aspiration pneumonia, just by brushing your teeth, you can reduce dramatically the risk of aspiration pneumonia.
Ruth's saying oral laser.
Yeah, for what disease though, oral laser, I guess. To stimulate saliva, to stop, so they can use lasers to get rid of cavities. Gotcha. Yeah, okay. I have heard of that, but I'm not sure how cooperative a person with cognitive impairment would be.
Yeah, I would think you'd have to be really willing on that one. You can purchase a coral. We're going to send you guys the link for purchasing a coral online. There's going to be a discount code as well, so it's definitely worth a try. Friends, I'm a big fan of trying lots of things, because you're going to want, what we find that we use with different types of solutions for dry mouth is we use a combination of multiple products. Some work better during the day, some work better at night. JJ has thrown in that link, so that way you've got that. But I will tell you, and you've got water pick in here, you've got all kinds of great stuff. We're appreciative of our fans of, and I'm just going to say water pick, Coral, Phillips, all these folks are our sponsors. Oral Cancer Foundation, Bellscope, really appreciate you guys. And then our series sponsors, also American Academy of Oral Medicine, National Foundation Swallowing Disorders, support for people with oral and head and neck cancer. I'm telling you, everybody signed up for this. Thyroid, Head and Neck Cancer Foundation, Thyroid Cancer Survivors Association, our friends from Side Effects Support and Adaptive Equipment. They're coming up on Thursday, so I won't give that away just yet. And of course, Allison, our friend with the Negative Space, is a great podcast and lots of resources. I see you, Colette. I want to make sure that you guys know that we will be sending out that survey tomorrow and the email with all the links for this recording. And of course, tell your friends we've got somebody coming up. Real quick, a coral tastes like. Here's your answer real quick. A coral is not meant to have a taste. It's meant to be kind of taste neutral. Would you agree with that, Mary? But I can tell you,
definitely.
It's kind of taste neutral, but there's always going to have some level of taste. It's just not what you expect. And it's not a bad. I don't find that it has a bad. I've used it myself. So I hope that answers your question. Mary, would you add anything to it?
Nope, I would not. Yeah. But okay. I do want to add, thank you so much for doing this series and calling the attention to older adults and their oral health issues.